people are getting younger and younger. I think we've always thought of liposuction, or we've thought of plastic surgery as something for the age. You're getting old, wrinkly, 60, 70-year-old. But we really see, I think our peak, if you look at it, is probably a bimodal peak. The first peak is about 40. And I think that's when people start to feel a little bit insecure about, their bodies. And then we see another peak at around 60. But now we're seeing people in their 20s. It's very, very common for women in their 20s to come in who want liposuction, obviously breast augmentation. It's always been something for the women in their 20s and 30s. And we see some patients 18, 19, 20, and that's more commonly asking for rhinoplasties and maybe some liposuction, but it's creeping down. The age is really, really creeping down. What's too young? I think you have to understand the procedure you're getting done and the potential long-term side effects, the long-term scarring. And I don't really think you can understand that properly under the age of probably 20. I think we've had a couple of patients in their teens come in for breast reduction because they really were having problems with their back and back pain. And they had very, very legitimate reasons, but I think even after doing the surgery, it's very difficult for a 17-year-old, 16-year-old to comprehend what to expect after surgery and the long-term ramifications of what they do. Sometimes you have to be a psychotherapist and kind of glean out what's the reason. If a parent's coming in pushing a 16-year-old to get a nose job, does the 16-year-old really want it? Or is it something the parent wants? And I think if you can understand why they're getting it done, you have a better feel for whether you should do it or not. Yeah, I tell people no all the time. I mean, they have to be doing it for the right reasons, and they have to understand why they're doing it. We even have so we have mothers who come in or parents who come in whose daughters are overweight, and they really want their child to lose weight. Well, liposuction is not really a weight loss procedure, and so that's an inappropriate utilization of liposuction. So I think the things that I think about are, why are they getting it done? What is their expectation? Can we meet that expectation? And are the reasons they're getting it done reasonable?